if someone experiences birth trauma, what they can do is they can start to suffer with kind of reimagining or reliving those events. So that could take the form of, for example, nightmares. It could be that they have frequent flashbacks of the birth or events surrounding the birth. They can be triggered. So unfortunately, I've heard of different things that can trigger women. That could be, even I heard not so long ago someone being triggered by the sound of a cash machine because of the beeping that it made. It sounded like medical devices which were near the woman when she was giving birth. It could even be in a conversation, someone talking about their own birth, for example. And that kind of looks at or moves on to things like avoidance. So someone starts to avoid situations where they might talk about birth, or they might kind of be reminded of their birth.
Welcome to the Motherhood Clinic, a podcast about caring for mothers after childbirth, led by clinical experience and real life stories. If you're a new mom and ever asked yourself, is what I'm going through normal? Should I be worried? Or who should I ask for help? This podcast is for you. It's for anyone navigating those early weeks, months, or even years after having a baby. Each episode brings together voices from across the motherhood journey, from clinicians, experts, and mothers from all walks of life. We're here to help you feel more empowered in your unique motherhood journey. We believe in a better start to motherhood.
Welcome, Emma, to the Motherhood Clinic podcast. Thank you for joining us. Let me set a bit of the scene for what we're talking about and why. We met a few months ago through your CTO, Nicholas, when I thought he was stealing my laptop bag at a health tech event. So that was a fortuitous meeting. Since then, we've had conversations about the businesses that we're both building, and I'm really keen to talk to you about Cocoon. Well, let me frame, what are we talking about? We're talking about birth trauma. What is it? When does it happen? What can you do about it? I'd love to hand over to you, Emma, and I'll stop the talking, but just to talk a bit about you in the first instance, and then I'll lay the scene in terms of what are we aiming to talk about in today's conversation. So, Dr. Emma Thornton, love for you to give a bit of an intro to our audience today.
Yes, thank you so much for having me on, Patrick. I'm really excited to come on and speak more about birth trauma. I'm a doctor by background, initially specialised in obstetrics and gynecology. And then after about 5 years, I moved into general practice and very much kind of focused on women's health. So done some extra things to do with menopause and also very interested in medical leadership as well. So done a little bit of stuff around that, which I suppose those things combined, plus being a mum and having 2 babies myself, kind of resulted in my own startup or founder journey as well.
Excellent. Thank you, Emma. Now, we're going to have 2 conversations. And as we typically do, we kind of split up all the different challenges that we can face as new mothers or new parents in kind of 2 parts. So one, this conversation for those listening in will be about really raising awareness and understanding of what birth trauma is, the prevalence or relevance. Again, it's not going to happen to everybody, but when it does, you'll want to know really what it is you're dealing with. And then in the next conversation, we want to talk about, well, what can you do about it? Both from navigating the system better and that 6-week check, and also what can you do personally as either a mother, a carer, or a partner. So those are the 2 conversations we'd like to have today. I'm going to try and set the scene, and then I'll obviously hand over to you. So for today's conversation, which is about really an education and an awareness of birth trauma, we're going to talk about really what is the scene today? What is the situation that we're seeing today across birth trauma? The relevance, the prevalence, how it's normalized at the moment. We'll talk about maternity, which is, really been in the spotlight lately. So why is that now? What are some of the trends or the reasons why it's being talked about more now? And then lastly, it sounds like a stupid question, but why is it important to deal with birth trauma, right? Why is that important? What's the impact that it has? So those are the 3 things I'd love to try and work through with you, and also talk obviously about the business you're building to, which aims to address these. So In that first bucket of, a bit of a scene set, can you help me talk through the situation today that we're facing in birth trauma to give people an idea of, what is it and why is it important to deal with?
Yeah, of course. So I suppose it'd be good for me to start off with what the definition of birth trauma is. So that can be any physical or psychological injury that's experienced by parents during or after their childbirth that can have a lasting effect on their health and well-being. And in the UK, we think that the numbers are as high as 4 in 10 women experiencing birth trauma. So it's quite
Hmm.
big numbers. And I think there's even numbers quoted as high as 45% by the WHO. Now, with birth trauma, there will be a number of women who go on to develop more serious mental health problems, such as post-traumatic stress disorder, as a result of
Yeah.
their birth. And
Hmm.
there's kind of, if I suppose we could go into what that looks like or what signs and symptoms of that look like, and how that can impact on someone. So if someone experiences birth trauma, what they can do is they can start to suffer with kind of reimagining or reliving those events. So that could
Hmm.
take the form of, for example, nightmares. It could be that they have frequent flashbacks of the birth or events surrounding the birth. They can be triggered. So unfortunately, I've heard of different things that can trigger women. That could be, even I heard not so long ago someone being triggered by the sound of a cash machine because of the beeping that it made. It sounded like medical
Hmm.
devices which were near the woman when she was giving birth. It could even be in a conversation, someone talking about their own birth, for example. And that kind of looks at or moves on to things like avoidance. So someone starts to avoid situations where they might talk about birth or they might kind of be reminded of their birth. So that could even be kind of TV shows. So, for example, trying to avoid something coming on the television like Call the Midwife or One Born Every Minute, something that can
Hmm.
kind of be a trigger in itself as well. And then that could even move into things like avoiding healthcare settings, which is a bit more of a worrying thing. So women not maybe wanting to engage in healthcare or go back to a particular hospital or see a doctor because that can then remind them of their birth and their trauma.
Hmm.
Um, and then the other thing that women often feel is very anxious, and not only
Hmm.
anxious, but they feel quite what we call hypervigilance. So they feel very tense. They feel like they're always on high alert as well, and they can struggle to relax as well. And then sometimes as well, it can have impacts on mood. So that could be that
Hmm.
someone's feeling very low in mood. And often women who experience trauma, birth trauma, they often talk about kind of self guilt or self blame as well. They have
Hmm.
feelings that, particularly if they feel like that they feel it was their fault. And
Yes.
it's never their fault. But I think that unfortunately, a lot of women have this feeling or they carry that guilt with them, which is a very big, kind of burden to bear as well. So they're the kind of the main signs and symptoms that someone can have with that distress. Now, if
Hmm.
someone's got a lot of those symptoms or all of those symptoms, then it can be that they go from being in the territory of kind of birth trauma or the distress from birth trauma into that PTSD or um, post-traumatic stress disorder. And
Hmm.
obviously, these things they can impact on someone's quality of life. They can impact on relationships, etc. So it's a big thing for a lot of women to experience, whilst they're also looking after a newborn baby, which is
Yes.
quite stressful and hard work in itself.
Well, and again, as you're talking, Emma, it reminds us partly of our journey, as any parent would experience. I remember we tried to make the bedroom setting as calm and peaceful as possible, and we would play like nursery rhymes, and we had this really comfy chair. Ironically, those became triggers for the difficult moments that we experienced. And so the sound of a particular nursery rhyme and that chair then became kind of almost like these negative associations of all the pain and trouble that we went through. It makes sense, but it's also a bit ironic in terms of, what those things are. And that will differ from everybody, I presume, right?
Yeah.
Um, yeah.
And I think it's important as well to mention, and I know that we speak about birth trauma, but I think the better lens to look through things is to think about this as an umbrella term of perinatal
Yes.
trauma. And so from
Yes.
that, starting with, for example, fertility struggles, that it could be, baby loss, miscarriage, all the
Yes.
way through to breastfeeding guilt as well, which is another
Yeah.
kind of area that we often don't talk about. We often don't talk about how women feel when they are unable to breastfeed, or for them breastfeeding hasn't worked out. And again, there's that self-guilt and blame as well element to that. So I think ideally we should be, if we can, as a collective, raising the profile around the whole of the perinatal trauma space.
Yeah, I think that's a really good call out, Emma, because there are so many of these events that can cause, as you're saying, that level of trauma, and that, there's a whole spectrum of what someone will deem as trauma. And I guess stepping back, I'm guessing a couple of the key challenges you've got is, number one, if it's your first time, you just don't know what normal is, right? Is this, there's a level of challenge to the events you've just described. If it's your first time, you're like, well, isn't everyone go through this? And is this okay? Like, where is that red line? And part of that will also be to do with your expectations. And again, what expectations do you have if it's your first time? So I imagine so much of the challenge is a psychological one, right? Which is, I've never experienced this before. I don't know what normal is. I don't know I've never been tested in such a way. Plus I've got like 5 other things that are going on. So it's very hard to then work your way and dedicate the effort to address this trauma, or even identify it, right? I imagine.
Yeah, I think it's really hard because I think each birth is different. Each birth story is different. And I think that, like you say, there's no textbook, on birth, as in there's no kind of, this is how it is going to go, your birth. This is, we can hope and aim for the best, and we can hope and aim to have a shared plan, which is what that patient or that woman is aiming for. But sometimes birth throws us a curveball, and we have to go with whatever is safest for mum and baby, and make sure that mum is informed the whole way along that journey, because we know that risks for birth trauma are that unknown. So not having information, feeling uninformed, feeling no one's communicating to you, feeling not listened to, feeling ignored, that is the recipe there for that psychological kind of trauma. And I think that is something that we need to be really mindful of for women that are giving birth, and creating that. I think the term that is often used is environment of psychological safety. So making sure that we are listening, we're offering that information, and offering that information early as well. I think one of the problems that we can encounter is people not feeling informed, but maybe because we've not felt that we can educate them when they're pregnant, because we're worried about scaring them. And I think we're kind of maybe doing women, again, a bit of a disservice there, because I think, for example, someone fully understanding a cesarean section and what that would entail in an antenatal clinic is very different than trying to consent that person for that surgical procedure at 2 o'clock in the morning, when they've gone through a very stressful, labour so far, and potentially having medication, being high on adrenaline, etc. It's very different. So I think there's maybe a piece of work around actual antenatal education that we need to be thinking about as well, to try and see if we can inform women better. And I think that's a really variable process. I think there's probably some birthing units and some maternity units that are doing a really good job on that. And I think there are maybe some where we need to maybe think about better ways to do things. And I think that probably feeds into your earlier point as well of why is this such a high profile issue at the moment. And I think, one of the reasons is because we keep seeing the same themes coming up over and over again, and we keep having a number of inquiries as well. So I think the Ockenden inquiry was in 2022. And at that point, women were saying that they didn't feel listened to. Debriefs were inconsistent. And then again, at the 2024 birth trauma inquiry run by Theo Clark, it was the same again. And now we're having another inquiry by Baroness Amos. And although that inquiry will take time, as all inquiries do, I think that, her first findings are things are worse than she thought they would be. Now, we've had 700 recommendations from some of these inquiries, and none of them, or should I say 700 of the recommendations haven't been implemented. There will be others that have been implemented. But I think one of the problems that we're getting into now is this kind of cyclical loop of keep trying to find what the problems are, but maybe not coming up with so much in the way of actions.
Yeah, analysis paralysis and inquiry after inquiry. Of those, there's a lot that I'd like to kind of dig into. Before I do that, I will preface part of this conversation, as we've spoken about, is, again, part of the challenge is trying to provide what I would see as a realistic picture of what's coming through, because you're saying not everyone will experience birth trauma, but some people obviously do. And it's trying to, as you've said before, like, how do we raise awareness? And there's obviously going to be a natural barrier where people don't really want to know the bad things that are going to happen. I mean, I talk about this personally, where we planned as much as we possible to have what we hope to be the best birth possible. And you don't really sometimes want to entertain the problems that might encounter, because you don't psychologically want to go there. And so I think your point is so critical about how we educate people and make them aware, and that delicate balance between, this isn't about scaremongery, but it is painting a realistic picture, the positive and the negative of what might happen, and then dealing with what are some of the systemic issues in the system, and what can you do about it. So I think we just want to, hopefully in this conversation, we're not just here to say, look, this is going to be happening, right? It's more just this could happen and everyone should be aware of it. So that's kind of where part of my take on this conversation.
Yeah, 100%. And the whole point is we want women to have beautiful births. We want them to have amazing birth stories. We want them to have the birth that they want. And, when I was working in obstetrics, that was always the goal, and that birth plan that a woman brought in, we wanted to be able to support that as much as we can.
Yes.
I think part of the problem that I encountered was that some services changed during COVID. So, for example, we used to be able to do things like labour ward or delivery suite walkarounds prior to COVID, where women could come in, they could have a walk around the delivery suite. Some of the sessions were in person, some of the antenatal sessions were in person, and a lot of that stopped during COVID, and it never started again. And I think that was a bit of a barrier for women to be able to enter that environment before they had a baby. They were able to kind of look around the delivery suite. The other thing was it gave an option to maybe ask some of those questions. And I do think a lot of these sessions are taking place. Some of them are taking place virtually. But yeah, I think that certainly COVID probably didn't help in some aspects.
Why did it not restart? Was it just a capacity funding issue?
I'm honestly not sure. And I think each unit will be variable, and I can only comment for the ones that I was working at. And I'm not entirely sure. But I'm sure there will be people listening on here where they have restarted again. But I think that's quite I think it's quite a nice thing for a woman to be able to do, is to maybe familiarise herself with her environment. The other thing is if we can get continuity of care as well. So if the woman can see the same midwife, if she can ideally, have that midwife in her delivery, that's fantastic. The problem is the staffing system is very difficult to allow that to happen. And we don't, I don't want to sit here and kind of NHS bash, because the doctors and the midwives and the other supporting staff in theatres and the administrative support, etc., are doing amazing jobs. It is an incredibly hard job to do, and it's a very hard environment. It's physically demanding, emotionally demanding, and they're doing amazing work. But I think as some of these inquiries have suggested, there needs to be a few changes just to make the experience not only of patients better, but also of the staff better as well.
Yes, I 100%. As both as, you're a clinician that's worked in the NHS. My wife is, a clinician as well in the NHS. And as you're saying, as this conversation this is about awareness. It's knowing about what is available in your district, in your region, and what you need to be watching out. Because then at least you can do something about it, or you can at least know what to expect to some extent, right? What were some of the key things that do you think have come out from those reports that people should be aware of?
I think some of the key themes are women maybe not feeling that they're listened to, and that maybe they feel like they don't have the opportunities to ask the questions. So particularly, I think one of the things that gets brought up is the debriefing process.
Yes.
And so, and there's a lot of different thoughts on debrief, and that can be around timing of debrief, for example. So should it be done straight away, literally after birth? Should it be done before a woman goes home? Should it be done later? And what to include in that debrief. And unfortunately, I think it's very hard on sometimes skeleton staffing in a maternity unit to give a woman a full debrief, or the debrief that woman needs. And then I think that often debriefs as well are reserved for women who've had often quite severe complications. It might be that maybe they've had to go to high dependency or intensive care, or they've had to have, go back to theatre, etc. So I think sometimes debrief tends to be almost like reserved for some quite surgically complex or medically complex patients, as opposed to women who have had a birth and they feel that birth was traumatic, but they had a positive medical outcome, for example. So they had a healthy baby, they didn't need to have any, going to theatre, etc. But they still felt traumatized by their birth. And I think that group of women probably struggle to get, the debrief that they need. And it's that problem then of waiting sometimes quite a long time to then be debriefed by a specialist in an outpatient clinic. And obviously, as time goes by, first of all, it's memories. They can, not only can they fade, but they can change as well.
Yes.
And the other thing is that, particularly with birth trauma, it's that without that debrief, obviously that birth trauma can persist. Those questions can ruminate, and women can be struggling with some of the symptoms that I mentioned kind of at the beginning. I think I was very fortunate that at one point I worked in a unit where our policy was actually to debrief any woman who'd had any type of kind of surgical intervention, any kind of problem in pregnancy, such as gestational diabetes, hypertension, etc. They all had a debrief before they went home, and they were given written material to take home with them. And that worked really well. That was in a district general hospital. It wasn't in a huge tertiary centre, specialised centre that took on, super complex deliveries with like tier 3 neonatal units and stuff like that. So I appreciate each unit will have its own barriers to doing that debrief. And the other thing is sometimes patients are desperate to get home as well. And sometimes they don't want to wait,
Absolutely.
sometimes hours for a doctor to be available. They think, I want to get home and I want to get home with my baby now. I don't want to sit and wait around. So, there's lots of things in that. But yeah, I think the debrief is something that I think is overall is something that we could do better, because the other thing is, from a primary care point of view, or wearing a GP hat, it's making sure we ask and flag those women at that 6 to 8 week check that might need that debrief as well. That's maybe that we maybe didn't have on our radar for formal debrief.
And let's imagine a pregnant first-time mother listening in. Can you, in a nutshell, describe exactly what is a debrief and what is it for? Because not everyone might be aware of that, right? So what is a postnatal debrief, and what should it cover?
So the debrief really should cover, ideally, I suppose, any problems that have had in pregnancy that might pose a risk for someone's health further down the line, or in future pregnancies. It should talk about the birth itself. So it should talk about kind of any incidents within that birth. It should ideally explain. So, for example, if you needed an example, for example, like a fetal blood sample, which is where we would do a small scratch on baby's head and take a sample to assess in one way if baby's struggling or is in distress. At the time, that's quite a chaotic thing to be happening in the room, and someone might not fully understand why is this happening, or why did that happen. So, and it's an opportunity to discuss those things, so a person fully understands the events that happen in their birth, and then to talk about any kind of post-operative or post-birth management or potential complications. So that could go from, for example, someone needing blood thinning injections, or it might be that they needed blood pressure monitoring, or it could even be about when do they plan their next pregnancy. So, for example, in the context of having a cesarean section, waiting, what's that period of time that someone should wait until they have their next baby? What are the recommendations, and why are those recommendations? And ideally, again, they've just had a baby. They're probably very tired if you're debriefing in hospital, then giving someone literature. And ultimately, it's an opportunity for them to ask questions. It's their platform to ask questions. So the debrief really, probably the right answer is the debrief should be a platform for a woman to take that debrief where she wants to take it. But I suppose from a clinical standpoint, the kind of things we'd want to think about covering.
Yeah, so many great points in that response there, Emma, that I'd like to kind of unpick a little bit, in terms of someone, again, for the first time going through this, what should they really get out of it, as opposed to, I just want this done as soon as possible so I can get home. As you're raising there, this is an opportunity to really ask those questions. There is a separate conversation as to when the best time to do that is, not just after you've given birth. But I think, to a prior conversation that you and I had, when we look at birth trauma from afar, something that you mentioned where it can be as simple as asking, how are you, to the mother? So the right question at the right time. I say simple, but it's not easy, right? As we've just described, it's a simple question that can open up a wealth of, areas to dig into deeper. But the challenge is, when to ask it, how much time do you have? Is the mother in the right position? Do we have enough capacity? So, but I think, I think you really articulated it really well, which is it is a simple question that is just so often overlooked.
Yeah, 100%.
But it's so powerful. It's so powerful.
Yeah. I mean, my ambition would be that we have a mentality to that question, that it is every contact counts. So in that postnatal period and in that antenatal period, to be honest, but certainly in that postnatal period, if you're a healthcare professional and you're engaging with a woman who's recently had a baby, asking that question could be a lifeline that woman needs. So asking, how are you doing? How was the birth for you? And some people might potentially find that second question triggering. So it's just thinking about the best way to phrase that. But certainly that first question, how are you doing? I think it's something that we need to, if we can, definitely start to think about asking outside the context of just that 6 to 8 week check, because sometimes it can feel that that's a bit of a checkpoint there, that 6 to 8 week check, and then women can potentially get lost to services. And
absolutely,
we know that 50% of women who experience perinatal mental health problems will not present, and they will kind of suffer in silence. So I think we need to be their sounding board for those interactions, and whether or not that's at an immunization appointment for their baby, whether or not that's someone coming asking about postnatal contraception. There's lots of potential different opportunities where we can just check in and ask that question. And yes, it might mean that you need to book another appointment. It might be that you overrun potentially in that clinic that day. But it's a question I think we need to ask a bit more.
Yeah. And that's where I think, to your earlier point about creating a culture or a feeling of psychological safety is so important, because I'm sure you've heard so many times, and unfortunately we've heard the same, where mothers that are asked that question are concerned about saying how they actually feel, because they're worried that they'll take the baby. Like if you knew how I felt, you would take this baby away from me. And that's such an unfortunate reality that I think a lot of mums face, where they feel look, I don't want to tell people because, they wouldn't trust me. And I think that's, the time to ask that and giving the space for, or to dig deeper to get hopefully an honest perspective of really what's going on is so critical, but also so difficult, right?
100%. And to be honest, if I had the money and if the staff were there and I was making these decisions, I'd be saying we need to have a national 3-month postnatal check as well. Because the thing is as well, we know that those first few weeks, often the partner might be on parental leave, the grandparents might be coming round, friends and family who want to meet the new baby.
Exactly.
There's a lot of activity. And then suddenly around that 3 to 4 month point, it drops off and you are there and you're in the trenches with a newborn and potentially other children. And it is hard. And particularly it could be that baby's got problems with colic. It could be that they're having mastitis, lots of different things. And I think that if I had a magic wand, I would make that a new standard of care for women. But I don't have that magic wand. But hopefully someone who does will at some point do something along those lines.
But to be fair, Emma, I'll give you credit where actually you are building something to address that. So, this is, I think, a good example where we are aware of the challenges in the system, but we're also doing something that we can hope, or building something that will hopefully address those. And part of this conversation as well is how do we, even outside of these offerings that we're creating, there will still be things that, mothers, partners, carers can also do with that level of education and awareness of what needs to go on. So as you're saying, like even identifying, do I have birth trauma in the first instance, and realizing that there will be some difficulties that, I don't know, whatever you call normal, that, birth is going to be a challenging event, no matter if it's good or bad or indifferent, right? But there'll be somewhere along that line where you want to have some sort of gauge of, hey, this is starting to veer into, I think we need help here. Whether that's you as the mother or someone that's looking in on the mother to say, hey, look, and sometimes it's often the partner that can see these things happening. And we'll talk in the next conversation about what can those partners do to help in the best way, because that's also a challenging dynamic too, right? But I think, the important points you raise about this is an ongoing thing, right? If you had any life event or any significant event, you'd want to revisit that. You'd want to provide, as you said, literature around what happened. You'd want to have a debrief. I mean, this happens in business all the time, right? It happens in other parts of our lives. We don't apply it to ourselves, right? So, any major event, you kind of you prepare for it, you go through it, you look back on what did or didn't go well, you plan for the future. And so we're just applying that same common sense approach to probably the most significant life event you can face, right? So I think it all makes sense when you look at it from that lens, right?
Yeah, definitely. I agree.
Yeah. In your experience that you've seen with new mothers, what's been, I guess, the impact? Again, I'm trying to answer the question, why is it so important to deal with birth trauma? I mean, we kind of inherently know why, but why? Why is this important for mums to know and to deal with? What's been the impact that you've seen?
Yeah, so I mean, I actually saw someone like clinically only in the last week or so that has had unresolved birth trauma that she's never really sought any attention for. That has now progressed to quite severe health anxiety around some of the events in her birth, to the point where she's now struggling a lot, kind of just with her ability to kind of leave the house, and impacting on her ability to kind of function and get around and do, things that she would normally want to do. We know that, that the unresolved birth trauma and kind of in the severe side of that spectrum, like post-traumatic stress, it can go on to chronic mental health problems. There are links as well with birth trauma and postnatal depression. And then those kind of problems can have other wider impacts. So one of the things that sometimes people experience is problems bonding with the baby. And that can be through, their own kind of feelings around the birth, but it can also be sometimes the fact that they're not with baby, or for example, that this feeling of guilt as well, that we were talking to before, and some of the issues around mood as well. And so that problem with bonding in the most extremes can have obviously impacts on things like child development as well. And the other thing is, it's not just relationships with the baby that can be affected, but also relationships with the partner as well. And you can have, relationship breakdown, because I think people can find it quite hard to communicate as well, and to communicate
Yeah.
why they're feeling the way they're feeling. On a kind of more bigger scale or global scale, it can also affect kind of the number of babies that are being born. If you think, for example, that you have a woman that's not been debriefed, that's experienced birth trauma, it might influence on her decisions around her future family. It could be that she'd always imagined having 3 children, but now she thinks that she doesn't want any more, and she's going to stick at 1.
Yes.
So it can have much more kind of long-term impacts for that whole kind of family unit as well. So yeah, the effects can be a lot longer than I think people would initially expect.
Yeah. No, thanks for that answer, Emma. I think you gave some very specific examples of the impact that they have. The reason I asked that question is really just to speak to anyone and encourage them not just to push through, right? Because I think so many of the mums and people that you're going to see, that we hear, that we speak to, they have such a high resilience or such a high bar for themselves, where they're just like, I'll just push through, I'll keep going. You don't know what's normal. It's the first time. Everyone goes through this. So maybe it's just me. And I think what we want to collectively call out is, look, if you address those things earlier than later, you hopefully resolve some of the cracks or the big things before they become these massive gaping holes, which you're not even aware of. So I think part of, your response, and just the clear reasons as to why this is so important to deal with earlier than later. And again, I recognize the never-ending challenge for mothers and for parents, which is, well, there's always something more important right now than me, right? It's the baby, it's the bills, it's the work. And so it's so easy and tempting to put off the checks, or even, I don't know what the uptake of even the 6-week check is. Sometimes people just forget to book it in, and they were like, oh, I'll deal with that a year from now. But we've heard too many stories, and hopefully this conversation will be part of that, to raise awareness. Like, look, this is really important. Like, how do you prioritize and raise that sense of urgency for yourself, so that you deserve this, right? And I think you've called out some very clear reasons as to why that's important to do, right?
Yeah, and I think women need to advocate for themselves. So particularly if you feel that you go to a healthcare provider and you're telling them that you're feeling low or anxious, or that you're having flashbacks, or you are being triggered in some way, and if you feel dismissed, I would say speak to someone else, because someone else will listen. And it might just be, unfortunately, you've spoken to the wrong person. And the other thing, like you say, Patrick, is, as mums, we are notorious for kind of putting on the oxygen mask for everybody else before we put on our own. So if you are finding it difficult, because it is hard to get a newborn baby or a small baby dressed, ready, into a car seat to make a particular appointment time, particularly if it's a ring on the day, and can you get here in the next half an hour, whatever. That baby will often need a feed, be sick, have a dirty nappy, etc. And it just becomes this absolutely nightmarish situation, just trying to get out of the house. Even saying, can I have a telephone appointment? please could I have a telephone appointment instead of a face-to-face appointment? I'm finding it really hard to get out of the house at the moment, but I really want to talk about how I'm feeling. Like, that's one way. And the other thing is, with the 6 to 8 week check as well, I think that there can sometimes be a feeling that we focus a lot on baby and not so much on mum. And that is often just because of the sheer volume of stuff that GP is expected to get through on that 6 to 8 week check. But if you go to that appointment as a new mum and you feel like you did not come away saying what you wanted to say, or feeling like you've not addressed issues you wanted to address, please make another appointment. Please get an appointment for yourself if you can. If your partner is able to have baby for you for that appointment, or if someone's able to come with you to support in the waiting room so you can nip in and have that, 10, 15 minutes for yourself, even better. But just, please, just a message to all women, advocate for yourself. There are people there who want to help you. So please come forward if you're struggling.
Excellent.
Yeah.
Excellent. And that's a message also, not only for mothers, but for those caring for the mothers, right? They can do that too. So,
definitely. And that's a really good point, Patrick. Sorry for interrupting.
No?
That's a really good point, because what I've not even said is actually 1% of dads will get PTSD after birth. So, and dads will also, encounter difficulties witnessing a traumatic birth and going through that period of time as well. So again, we need to be making sure support is there for dads. And that is an area which is chronically under-resourced and underfunded as well. So we need to be taking care of everybody in that family. Oh, and not just dads, birthing partners, whoever's been there at the birth.
No, that's I think a good call to action. I think to wrap out this conversation, as I was saying, whether it's the mum experiencing that, or for instance, me as the partner saying, I don't know, I would want my wife to have more than this because I don't think she's being listened to, or for myself. Those are all great reasons. So Emma, thank you so much. I want to delve into the next conversation where I want to talk more about Cocoon and the work that you're doing to resolve these challenges or to address the problems that we've just talked about. But hopefully from today, anyone listening in will hopefully have a better understanding of what is birth trauma, why is it important to deal with, and just start to, I don't want to say normalize the conversation, but make it raise it to where it needs to be, because all too often we sweep these, these not so nice things under the carpet. We don't want to talk about it. And I think we can only start to deal with it when we talk about it. So Emma, real pleasure to chat to you, and we'll be back soon.
Thank you very much for having me.
Thanks, Emma. Cheers.
Cheers.